So these are the neurotoxicity risk factors. So the gestational age less than 38 weeks, and this risk increases with the degree of prematurity. Serum albumin less than 3. We will discuss the bilirubin albumin ratio later as well. Isoimmune hemolytic disease, that is a positive direct antiglobulin test. G6PD or other hemolytic conditions. We know that hemolysis may increase the risk of bilirubin neurotoxicity, as the blood breakdown products may compete with albumin binding sites, and so more free bilirubin may be present. So we have to have a lower threshold for treating these babies, and even a lower threshold for exchange transfusion, especially if the baby becomes symptomatic. Sepsis is a risk factor as well, almost for the same reasons, because you cannot predict the course and there may be factors that compete with albumin binding. If the baby has significant clinical instability in the previous 24 hours, so this is a subjective decision and it may be based on birth asphyxia, for example, hypoglycemia, sepsis, acidosis, hypothermia. Any of these may make the baby unstable. If it is a significant instability in the previous 24 hours, you need to treat with caution. So the neurotoxicity risk factors have also been modified from the previous guideline. The approach to measuring albumin is if your bilirubin is going high and you are coming close to treatment level, it's recommended as a workup for measuring, and then when you go to escalation of care, it becomes one of the important criteria as well.